Okay, here's a screencast on depressants. Things to look for in this is to describe the effects of depressants, which is different, and then to discuss the social and physiological effects of the use and abuse of ethanol, describe the synergistic effects of ethanol with other drugs, and describe and explain the techniques used to detect ethanol in the breath and blood and urine. Okay, so let's start with depressants. The definition for the depressant is that it acts upon the central nervous system, CNS, the brain, and the spinal column. It is important to know this definition. Okay. It acts by affecting the communication between brain cells and specifically by changing the concentration of the neurotransmitters. Okay, the overall effect of a depressant is a decrease in the brain activity. That decrease in brain activity influences other bodily functions such as heart rate, breathing rate, things like that. Okay, so at this point, I have to know the definition and that it affects brain activity. So let's look at depressants versus antidepressants. And I found this a little confusing, right? But depressants act on the central nervous system to decrease brain activity. That's a definition. Antidepressants are medications used to treat clinical depression. Depressants can act as antidepressants. That's the confusing part. Many antidepressants, though, are not depressant, meaning they do not decrease the brain activity. So I'm going to remember this as DAD, all right? There's depression, which is the clinical diagnosis. Okay, this is treated with antidepressants. That's where the A in DAD comes in. Antidepressants. Antidepressants are sometimes depressants, meaning sometimes they decrease that brain activity. All right, so DAD, meaning depression, clinical diagnosis, treated with antidepressants. Sometimes those antidepressants are depressants, meaning they act on the central nervous system and decrease brain activity. All right, so a drug you may be familiar with is Prozac. Prozac is an antidepressant because it's prescribed to treat clinical depression, but it is not a depressant because it does not depress brain activity. So DAD, depression, clinical diagnosis, treated with antidepressants, of which some may be depressants, meaning it acts to decrease brain activity. Okay, it's important to know the dosage and the effect that those dosages will have for these depressants. There's tranquilizers, could be considered the mildest type of depressant, going to sedatives, and then going to hypnotic drugs. If you notice, these types of drugs don't really quite line up with the effects or the dosages because there is some overlap and some gray area. But it is important to note for a low or moderate dosage, okay, you get that tranquilizing effect, meaning calmness, relief from anxiety, and a muscle relaxant effect. And it is important that you will be able to name some of these effects for a low to moderate dose. For a high dosage, you're going to have more severe effects, meaning slurred speech, decreased heart rate, staggering gait. You've ever seen a really drunk person try to walk? Altered perception, and sleep is induced. All right. The next highest, very high lethal you get respiratory depression, coma, and death. Okay, so it is important to know these dosages and the effects at each dosage. So let's talk about a specific depressant, named ethanol. Ethanol has the formula CH3CH2OH, which you should know. It is found in beer, wine, and hard liquor. It's been in use for over 5,000 years, dating back to the ancient Egyptians. It is the most widely used psychoactive drug. It is legal in most countries, and this is really because of the cultural aspect. Probably if this were discovered today, it would not be legal. Probably fall on the lines of marijuana. All right, so the metabolism of ethanol. You won't be asked specifics about the metabolism of ethanol, but you should have some background as to how it goes about interacting in the body. The molecule itself is polar, that hydroxyl group on it, and that makes it soluble in water. It can also dissolve in lipids. Okay, that means it can easily cross cell membranes. It crosses the placenta into the fetus, and it passes into breast milk. Ethanol is absorbed quickly into the bloodstream. It's broken down by the liver. 90% of it is broken down by the liver. The remaining 10% is eliminated through the kidneys and through the lungs. That's exhaled in your breath. And absorbed quickly into bloodstream. This is through your GI tract, which you can probably guess. Okay. Uses of alcohol. Users become more relaxed, talkative, confident, and that's why it is used in adult social gatherings, situations. It reduces your heart rate, so it is a depressant. And there are some beneficial effects on the circulation. It dilates blood vessels, and this is thought to reduce heart disease in low doses. Okay, low doses. Okay, it is also used topically as an antiseptic. Okay, it's used to treat wounds. And it stings a little bit when you treat wounds with it. Okay, short-term effects of ethanol abuse. You will need to know these, probably 2 or 3 of these, so make some flashcards perhaps. Short-term effects, there's loss of that self-restraint, impairment of memory, concentration and insight, loss of balance and judgment, sometimes violent behavior, definitely risk-taking behavior, and then dehydration occurs because of the increase of urine output. High doses can cause vomiting, loss of consciousness, coma, and death. So those would be short-term effects. What happens over the long-term abuse of ethanol? Well, it can cause a dependence known as alcoholism. You have liver diseases, cirrhosis of the liver and liver cancers, coronary heart disease, high blood pressure. If taken in heavy doses during pregnancy, you will see fetal alcohol syndrome, and it can cause permanent brain damage. Again, these long-term effects, you will need to know 2 or 3 for the IB. In addition to the short-term and long-term effects of alcohol, there are things known as synergistic effects. And what that means is that things like ethanol will enhance the effect of other medications and drugs. Okay, for example, aspirin. If aspirin is taken along with ethanol, you get an increase in stomach bleeding. Okay, in other depressants, such as sleeping pills, can lead to coma, okay, and death. In tobacco, it actually increases carcinogenic effects, and meaning cancers become more likely. Oops. Okay, and then other drugs. Because the ethanol depresses the central nervous system, other medications are going to be processed differently. So, now that we've gone through the health effects of ethanol, let's look at the analysis of ethanol. And this really assists law enforcement in testing so that you can prove who is driving under the influence. So when a person ingests ethanol, there's an equilibrium set up between the ethanol in your blood and the ethanol that is exhaled in your lungs. 5 to 10%, remember, of the ethanol is expelled through the kidneys and lungs. So this is up to 5 to 10% is removed through your breath. You need to know that there are two methods for breath analysis, and that is the Breathalyzer, which I'm sure that you've heard about, and the Intoximeter. Okay, and what we're going to do is we're going to look in greater detail how these two instruments detect and quantify the amount of ethanol in the blood, and then we will look at some of the actual blood analysis as well. But for breath analysis, Breathalyzer and the Intoximeter. All right, as we learned in the organic unit, alcohols can be oxidized in the presence of potassium dichromate, changing the color from orange to green as the dichromate is reduced from a chrome +6 oxidation number to chrome +3. Okay, and that reduction happens as the alcohol is being oxidized to the carboxylic acid. Okay, so really the suspect breathes into the breath analyzer, and what they're looking for is just a color change. And that change, the degree of color change, can be equated to the percentage of alcohol in the blood. Okay, so it's important that you remember that the dichromate being reduced changes colors along with the oxidation of the alcohol to the carboxylic. Okay, so let's take a moment and look at the actual half reactions. For the oxidation reaction, we're going to be looking at the ethanol to be oxidized to the carboxylic acid. Balancing that half reaction will require 4 hydroniums and 4 electrons. So that is the oxidation. Remember, anytime you have an oxidation, you also have to have a reduction. So a reduction is going to occur in the dichromate ion. And if we balance this, oops, that's a +3. That is the half reaction that we would get. It is important that you are able to do those half reactions and balance them appropriately. Okay, so moving on to the Intoximeter. This uses infrared spectroscopy, which is commonly referred to as IR, to analyze for the ethanol. How this works is you take the sample, the material is going to be scanned. Scanned over a wide range of wavelengths. Lambda's wavelengths. Okay, and that's called the IR region. There are going to be certain wavelengths that are going to be absorbed. Some wavelengths absorbed, and these correspond to the bonds, vibrational motion. And that's really what they say up here. And those vibrational motion absorbing of that wavelength, you can relate this to functional groups. The group that it's related to in the Intoximeter looking for alcohol is actually the CH bond. Okay, the CH bonds in ethanol absorb at about 2950 inverse centimeters. And the intensity of the peak that shows up in the IR spec is corresponding to the concentration of alcohol that's present, or ethanol that's present. This is what an actual peak looks like, and you can see that we're looking here for that CH stretch is what it's called. You would think that we would look for this OH, but the problem with that is in air we have H2O. So you can't differentiate this OH stretch as the alcohol, or is it the water in the air? So this is not used. It is the CH stretch that's used to determine the amount of ethanol in the air. So that's what you're looking for. It's important to note that. It's important that you know that this happens at about 2,950 inverse centimeters. Okay, and that's the CH stretch. It's important to know that you don't look for the OH stretch because there's water vapor in the air. Okay. There is a different Intoximeter that uses a fuel cell, and this is based on the principle that ethanol is oxidized to ethanoic acid again, and it makes water and carbon dioxide. The fuel cell can convert this energy released when that oxidation occurs to a detectable electrical voltage. That voltage then is used to measure the ethanol concentration very accurately. Don't think there is going to be much that you need to know about this, just that it exists and it works off a fuel cell, converting energy to an electrical voltage. Okay, the last analysis technique that we're going to talk about uses a gas-liquid chromatograph, and that is testing for ethanol in blood and urine. Basically, the sample is vaporized and it's mixed with an inert gas, and that's called the mobile phase. And that mobile phase flows through a tube, which is called a column, and that tube contains beads coated with a non-volatile liquid. That tube containing those beads is called the stationary phase. As that gas travels through this column of beads, different compounds are retained more or less by the stationary effect. And then you analyze the outcome of that gas phase for the different components as they are made to slow down or speed up through that column. This is what a gas chromatograph actually looks like. You have your carrier gas and your flow controller, your sample injector here, so your gas is flowing through your column of beads. You inject your sample. Depending on the components of the sample, they're going to get retained in this column at different points or different velocities going through it, and then you have a detector on the end that is going to generate a peak graph similar to IR. right? And if you look on the inside of the column, this shows that the beads being your stationary phase and your mobile phase with your sample being tested coming through. And that ends this screencast. Can we talk about benzodiazepines? It's a class of compounds that depress the activity in the part of brain that controls emotion. The effects of these would be tranquilizing, treating anxiety, treating insomnia, used as a muscle relaxant. The side effects are they build a dependence for that particular drug. Okay, you'll be asked to point out some similarities based on other medicines and drugs. Don't forget the data booklet, table 10. Things that you would be similar between these two would be the two benzene rings in each. You'll see the 7-membered rings with 2 nitrogens that are similar between these two, Valium and the Mogadon. I'm not exactly sure how you say that. You've got the amide functional group in both, and you've got the double bond CN group as well. The differences between the two, however, would be the this group attached is compared to a chlorine, and then the methyl group connected to this one nitrogen, whereas that only has a hydrogen. Okay. These are both soluble in fats and lipids, so it crosses that blood-brain barrier. And that's about all that you'll be asked to do with these particular compounds. And that ends this screencast.